science fiction writer Isaac Asimov once wrote about a universe where people existed in a realm of pure thought. In many ways, this vision is not as far off as it sounds. The Internet has linked the minds of people around the world, creating a new global culture. This new culture, or Infosphere, is defined by Dr. Boris Behrenfeld of Yale University as the growing unity, interdependence, and accessibility of information produced by humankind. The Infosphere is radically changing how we learn, work, and make the decisions that affect our daily lives. In Asimov's vision, you entered the plane of pure thought through a neural information gateway. Today, we too have gateways to our global Infosphere. We call them libraries. The North Carolina Area Health Education Center, or AHEC, supports a system of 9 regional libraries which are recognized by many health providers throughout the state as indispensable gateways to their global Infosphere. Here is what some of them have to say.
I sit before you a professional that has been made by libraries.
You cannot practice medicine in today's environment without access to a medical library.
It's much more than just a library. It's a digital portal into medical literature, scientific literature, not only for scientists but also for the patients who come to our hospital.
They don't ever stop till they find the answer, so they keep going.
They're friendly, they're supportive, they're responsive.
These healthcare providers, and hundreds like them, know that the AHEC network of libraries and the information professionals who manage them are indispensable supports to healthcare administrators, patient caregivers, health and medical educators, physicians and clinical providers, and scientific researchers. Here are some of the ways AHEC libraries have helped health professionals like you. AHEC librarians work with CEOs, CIOs, CFOs, people who are accountable for directing organizational investments in health education or information services. Knowledgeable administrators realize that information is a company's most important capital asset. AHEC library resources are vital to the growth of human and intellectual capital that strengthens personal performance and ensures organizational success.
So the importance of libraries and the importance of having people who know how to manage libraries is to make that asset, that very important asset called information, available to those who need to invest it when they need to invest it.
Working in direct patient care can be satisfying and rewarding. However, staying informed about best practices and new treatments in a rapidly changing environment can be very challenging. AHEC libraries help integrate on-the-job training into daily routines by providing access to information tools and resources at the point of care, when and where caregivers need them.
That helps our staff to be able to be on top of what the latest is in trends, looking at evidence-based practice as we look at what kind of procedures and treatments that we're doing to make sure that we're doing exactly what we need to and what is going on in the world today. We don't want to continue to do something the same way we've always done it if there's a better way to do it. And that's where I think we find our librarian resources really helpful to us.
Physicians and other clinical providers must make decisions every day that can have life and death consequences. It is critical that they have easy and timely access to evidence-based information that is authoritative, reviewed, and tailored to the specific needs of each patient. Trained AHEC library professionals help busy practitioners keep current in a research-driven field where the knowledge base changes almost daily.
The library and its resources help us in making real-time decisions that have the greatest consequence. These are our highest stakes, and this is what allows us to provide the expert and compassionate care to which we strive. And there is no greater imperative for us in emergency medicine or in medicine in general.
In an age when information grows at phenomenal rates, disciplined information management is a necessity for competitive survival. Health science students and their preceptors look to AHEC librarians not only to select, organize, and retrieve information, but also to help them learn how to access it.
It's not simply a matter of going out and purchasing a database of medical literature and making that available online. They continually look at what the needs of our learners are. They're continually going out and evaluating new products and helping to select those things that make the most sense to meet our needs, and they continually look for ways to make that more and more user-friendly.
Scientific researchers work hard to help the citizens of North Carolina improve their quality of life through advancements in scientific research and discovery. AHEC libraries facilitate scientific communication and collaboration by linking researchers around the globe to data and information networks.
Part of our research, it's very important that we maintain our reference collection up to date, and that we have copies of the most recent publications. So really on a daily basis, we use the AHEC Digital Library Connection to get the publications that are just out in print. We have a connection at our desks, also in our labs. And the other thing that's very, very valuable in our library here is the cooperative and supportive nature of the staff. That is a real plus.
As you have heard in each of these examples, librarians build the relationships and provide the services that help health professionals maximize their potential. AHEC librarians support healthcare administrators by building clinical information assets that promote the business of healthcare. AHEC librarians support direct patient caregivers by providing workplace training resources that helps them stay current in evolving best practices. AHEC librarians support physicians and other clinical providers by offering mediated reference assistance that facilitates clinical decision-making. AHEC librarians support health and medical students and educators by facilitating information access training that creates lifelong learners. AHEC librarians support scientific researchers by helping them make global information connections that facilitate communication and collaboration. They act as unobtrusive agents to help create both the visible and invisible dimensions of the global infosphere that links you to your personal knowledge resources, your professional community, and your world.